Hi everyone, my name is Richardson. I'm from Brisbane Plastic Cosmetic Surgery. Welcome to our YouTube channel. So for a woman that's contemplating cosmetic breast surgery, might be interested in breast implant surgery. Today we're going to cover the types of breast implants, the shells that they've got, the gels, the profiles, and when we would use certain implants and why we use other implants. So we'll get started. So what are the different implants available? Well, implants have been around for 40 or 50 years at least, and over that time they've changed in a number of ways. Over the years we've had saline implants, which are bags just filled with salt water, and we've had silicone gel implants, which are shells of silicone filled with silicone gel. And this silicone gel has changed over the years from being very runny back in the day to now a more cohesive gel that's less likely to ripple and is more likely to sit where it's placed. The shapes of implants can vary a lot as well. This is a teardrop shaped or anatomical implant, and you'll notice that it's got most of the gel in the lower pole and it sits in the breast like this, and it's designed to project the breast out in the lower pole and not have as much fullness in the upper pole, whereas a round implant is designed to have a little bit more fullness in the upper pole and not quite as much in the lower pole. Of course, when round implants sit underneath the muscle, they do get compressed at the top and they form a shape very similar to the teardrop shaped implants. One of the downsides with teardrop shaped implants is that they can rotate, and if this happens then they need to be fixed up, and that can happen in up to 20% of cases. A round implant, however, if it rotates, it's the same, all the different positions, so it doesn't need to be fixed for that reason. There are different surfaces on breast implants. This is a smooth surfaced implant, and that was the long-standing traditional surface on implants. Then there was a phase where implants had a textured surface on that looks just like that. This polyurethane surface was developed to increase the stickiness of implants so that they didn't rotate and to reduce capsular contracture. We now know that there are potentially some small risks associated with the textured implants, and that relates mainly to a very low risk of lymphoma, which is a low-grade malignancy called ALCL. And so we've known about that for a few years. So the trend at the moment is to go away from those implants and more towards a smooth implant, which has not been associated with the risks of ALCL. So implants also come in different profiles. You'll see that this is a moderate or low profile implant, and that relates to how much it sticks out the front, the projection of the implant, and that's a more highly projecting implant. So for the same base diameter, which is measured on the patient in the preoperative consult with a ruler, the profile is determined by how big or how much volume the patient wants to have. If you want a big volume implant, then you have to have a high profile implant or an extra high profile implant. So that's what profile is. In terms of size, when we try and work out what size that you should have, we do that together, and we'll try on different implants in bras. So when you come in, we'll measure the width of your breast, and then you pop a bra on, a trial bra like this, and then we use these chicken fillets inside the bra to get an estimation of how big you want to be. Further, when it comes to size, we have the capacity on a computer to take some photos of your chest and show you exactly how that size implant will look actually on your body, from the front, from the bottom, from the top, and it gives you a further indication of how big you might want to go when it comes to breast implants. So most commonly now we use a silicone gel, which is a gummy bear type consistency, designed to reduce rupture of implants, to reduce rippling of implants. And this Motiva implant, the gel is continuous from the inside all the way out to the shell. So it's not actually a shell pumped full of gel like this other implant. In addition, it has a nano-textured surface, still considered smooth, but that nano-textured surface helps reduce the rate of hardening around an implant long term, and that's called capsular contracture. So mainly I use Motiva implants, and they've been around the world for almost 10 years now, in this country about 3 years, and they've got very good rates of patient satisfaction and low rates of complications such as rupture and capsular contracture. Essentially the benefits relate to the gel and to the special outside shell. They come in a form with less upper pole fullness, which they call ergonomics, and that's designed for cases where you want more gel in the lower pole of your breast. For example, if you've got a little bit of droop to your breast, or you might have a tuberous breast with a tight lower pole, or you might want a very natural result. They're all circumstances you might choose an ergonomics implant, whereas a round implant with a more progressive gel is designed so that it will have more upper pole fullness and is perhaps designed for patients that like a slightly less natural appearance and don't need that extra gel in the lower pole. Thanks very much for watching this YouTube video on breast implants and the different options that you've got. And if you've got any other questions or suggestions regarding videos, please send them in to me. Hi everyone, and welcome to Brisbane Plastic Surgery. We're going to discuss lots of different topics today. Hi everyone, and welcome to Brisbane Plastic and Cosmetic Surgery. My name's Richardson.
I'm sorry. I'm just kidding.